Hi, I'm Kayla and I'm going to show you how to draw an AVG sample from the radial artery. So the first thing you want to do is make sure that you have an order to draw the blood gas. And since you are already in the chart to see the order, you want to make sure that the order hasn't changed. You want to see if your patient is on any blood thinners like Coumadin. You want to see their clot times, their labs for that. You also want to make sure there are no contraindications like a port, like a dialysis port or a wrist injury. You also want to make sure there haven't been any ventilator changes. If there has been in normal lungs, you want to wait 10 minutes. And if it's someone who has air trapping, then you need to wait 25 minutes after the ventilator settings have been changed. You then want to obtain all your equipment. So you need to get sterile gauze, you need to get alcohol swabs, you need to get the blood gas kit. So that includes a syringe, a needle, the pen lock device, and the syringe cap. You also need to get a biohazard baggie as well as pre-printed patient labels. And then after you do that, you want to go ahead and go into the patient's room, introduce yourself. You want to go wash your hands, put on gloves. You want to confirm the patient to make sure it's actually them. You also want to tell the patient what you're doing, so let them know that you're going to be drawing a blood gas sample and that you're going to have to poke them. So after you do that, you can go ahead and just get your equipment out and ready. So you can take out the needle and have the cap and the pin lock set up. You also want to loosen the cap, that way you can get the needle out or the syringe out easier. And then you want to make sure that you aspirate about like a milliliter of air, that way the blood has some place to go. Then you want to go ahead and do the Allen test. If the pulse is strong in both of the arms, then you want to make sure you do it in the non-dominant hand. So what you do is you block off both the radial and ulnar arteries. You tell the patient to flex or to pump their fist about 5 times, and then once they pump that, you'll see their hand becoming pale. You will let go of the ulnar artery, and then you will see the color come back. As long as it's within 8 seconds, and you're fine to do it. You want to then decide, like, you want to palpate, and you want to make sure that you can feel the pulse. Once you decide that's where you want to stick, you want to go ahead and get out your alcohol swab, and you want to scrub down the skin. You also want to scrub your fingers that are going to be touching the needle. Then you want to palpate with your non-dominant hand and feel for a pulse. You want to take your needle and you want to make sure that the bevel is facing upward. You are holding the needle like a pencil. You have it at 45 degrees. You then want to warn the patient, so you're like, okay, here comes a big stick, okay? So then you put that in there, and then you see the flash of blood. So once you see the flash of blood, you should have already had the gauze on their arm, but once you see the flash, you want to put the gauze over and remove, and then you want to put pressure on the arm for 5 minutes. So then you want to put the needle in there and take it off. You then want to put it on the cap, and you want to make sure you get all the air bubbles out, so you tap it and you get all the air out and you fill it, and then you want to make sure that you rock and roll it, is what it's called, to make sure the heparin mixes with the blood, to make sure it doesn't like coagulate. You then want to, once you do that, you want to go ahead and label the needle or the syringe. And on that label, you need to put your initials, what time the ABG was actually drawn, the date, the room number, that it's an ABG, and you also want to put the FiO2. If the patient is on a ventilator, you want to put respiratory rate, tidal volume, peak pressure, and PEEP. Once you do that, we're going to act like the 5 minutes is up, so you want to make sure your patient's doing okay. Well, first, after you label this, you also want to put it in a biohazard bag and label that, and then you want to make sure that your patient's doing okay. You want to make sure they're comfortable, that they're not bleeding, put the call button by them, and then you want to go ahead and take the ABG, run it, and document it, and that's what you do in ABG.